Ronell Nolan, President, CEO, Health Agents for America, HAFA, Monday News, coming to you live. Several things I wanted to discuss with you today, and this weekend I spent the weekend with Maggie Mae Nolan. Most of you probably remember her. She was my first assistant on her bachelorette party. And one of the things that I learned that was pretty disturbing, that folks that are looking to add to their income, or if they want to totally have their income come from strange things such as just jiggling your fat on the internet. They have a friend that totally supports herself by just jiggling fat on the internet. Now, HAFA continues to look for other ways for you to put money in your pocket and survive without having to jiggle your fat on the internet. One call I had this morning was with Agents for Hope, and we're working out our partnership and how we're going to be able to work together. But just a short kind of commercial, they are a GA type company, but the commissions do not go to them, they go directly to you. They concentrate on short-term medical. You are paid a higher commission than on your regular contracts. And then on top of what they receive, they send 20% to charities. The most recent charity they gave to was children trafficking. So I was really intrigued with, not only do they concentrate on independent agents and the importance of us being paid, they also give to charity, which, as far as I'm concerned, all our members and the agents across the nation are great people, and that's things that we do on an everyday basis. So look forward to get more information from Agents for Hope. 15 Republicans are pulling out of supporting reducing drug prices. Pharma says the Grassley-Wyden bill would siphon off more than $150 billion of R&D. Now, I've had conversations with folks from pharma, and if you ask them, about the R&D and why other countries get their prices cheaper, there's so many different things that are said, and the ball is always moving. And then you talk to universities, and universities say, well, we do all the R&D for free. So that dollar is always moved around about what is really R&D. But Wyden has threatened to pull his own bill. And I thought that this comment was interesting. How the hell can you say that your support protections when you have all the power and a bill did not pass that would support the Affordable Care Act? Casey said to Senator Cornyn from Texas. You've had 8 years of belly aching about it, and you haven't done a damn thing about it. So there was a little bit of cussing. Sorry about that. But that was a direct quote from Senator Casey from Pennsylvania to Senator Cornyn from Texas. The Kaiser Family Foundation has said most Democrats and Democrat-leading independents would prefer to expand the Affordable Care Act rather than replace it with their Medicare for All plan. So that's interesting. I get a lot of questions about Medicare for All and how we feel about Medicare for All, and our question is always, how are you going to pay for Medicare for All? A little plug to our NAPA partnership, who does all types of E&O, including cyber. You need to make sure that you're protected for cyber threats. You can reach out to Joe Peters. A lot of people have said at our conferences that I've talked to them, well, NAPA only does a certain program. That's absolutely not true. They will do a personalized plan for any type program that you need specifically for your agency. So please think about NAPA. They give HAFA a discount, our HAFA members a discount for their E&O, and definitely look into adding cyber to your portfolio. Some Florida news at this time: Cigna will be selling on the exchange in Collier and Palm Beach counties. And they're working on the commissions on how that would play out. So hopefully that means commissions are included. Something that came across my desk that you need to know about. The federal government, I continue to say, has been in our business. We know that on the individual side, and is getting into the employer business. And everybody thinks, oh, Ronell, some of you might not think I'm crazy, but some people think I'm crazy. I'm not crazy. They have said they're going to reach out to the employer market about HRAs. And recently, one of our members' clients got something from the U.S. Census Bureau asking all kind of questions about their health insurance. And what it said in the letterhead was, acting as a collection agent for the U.S. Department of HHS. Now let that sink in. Acting as a collection agent. Why are they collecting data? You need to protect your clients, not only from, losing your business, but from the federal government. It's important that you let them know exactly what's going on. And you might think, well, this is just a one-off. I posted this on Facebook. I received several people that wrote back and said they had been reached out to also about filling this out. I'm not sure that it is, that you have to do it. It's mandatory. However, anytime anybody receives anything from the federal government, their instinct is to complete it. This client asked their agent to help them. The agent helped. I mean, you're not going to tell your client no, but just be aware your clients are receiving letters from the U.S. Census Bureau asking very detailed questions about their health plan. One of our other partners, New Synergy, offers HRAs, and a lot of you are interested in the HRA, new rules and regs. It's an individual plan on a group chassis. What's that look like? There's some things that are still not out yet, especially the affordability rules and how those are going to play a role. But know that the government's going to be telling employers about it. If you're not the first one that tells them about it, they're going to wonder why the government told them first. And there could be some that change, drop their agent, and enroll in a plan that might not work for them, or a plan that does work for them, but then you would lose your clients. So absolutely make sure that you are talking to your folks about HRAs. Reach out to Jason Galvin at New Synergy. He has information about the rules and regs that he can send you in a PDF form that you can share with your clients. HAFA just recently partnered with Partnership for America's Healthcare Future. Absolutely showing that we're against a single payer program plan on the federal level and on the state level. So we have joined forces with those folks. I have reached out to them in the past and haven't got a response, but I'd like to thank Patrick Cassell from Nevada, who was working with one of his programs in Nevada, and they reached out to him. He sent them directly to me, so we now have given them our logo and our confirmation that we're fighting the fight. HMA, Hawaii Mainland Administrators, if you were not in Fort Worth with us or heard Linnea talk about reference-based pricing, if you have self-insured clients, you need to talk about reference-based pricing. Knowledge is power. This is a way to save dollars. She gave us graphs on the markup of hospital and what reference-based pricing, what implementing that is saving dollars. Reach out to Linnea. She is doing wonderful things. She's working in all states with all different agents. Give her a chance just to look at your plans. There's some people that are looking for 24-hour coverage. I know that's a program that she's been working on. So she thinks totally out the box. If you're looking to do something different that nobody else is, reach out to Linnea. I wanted to report that Oscar Health is reported an underwriting profit of $128 million. So they're absolutely making some money. One of our brand new partners that we introduced in Fort Worth is Community Doctors. You can find their logo, which will bring you to their website, on the HAFA website under Partners. It's a telemedicine for individual plans. Very cool. Includes telemedicine, dental, alternative medicine. Alternative medicine. That could be a key thing for your individual clients. $16.95 a month. So that's something you want to look into on the HAFA website. HAFA's Power Hour this first Wednesday in September, 2 o'clock Central Standard Time. The spotlight will be insurance advisors adding value. So you definitely want to sign in, listen in, learn a little bit about what's going on in Washington. It's what HAFA does, alternative to having face-to-face meetings. We know you're busy, you don't have time to leave the office. This is a way that you can join for 1 hour. We never last more than an hour, and you can learn a lot of things about what's going on in the marketplace. October will be CMS. They'll be joining us. It'll be Dean Mose, Blake Carlton, and Madeline from CMS that will be answering all the questions we need prior to open enrollment. So please join us and find out exactly what they might have to share with us that we need to know for those folks selling in the individual market. Louisiana will have a new player in the marketplace. They're not going to be selling in all parishes, but keep your ears and eyes open. That will be somebody that's being added. We do not know about commissions. We haven't heard a lot about it. The Department of Insurance told me it was a new player. I reached out to another contact, one of my intel, and learned a little bit more about it. But they haven't officially announced. Please mark your calendar for the HAFA Agent Summit. It's not too early just to save that date, March 5th and 6th in New Orleans. The theme is going to be the key to your success, and it's going to be at La Pavillon. We're going to have keynote speakers that are going to tell you how to succeed, individual and group market. What do you need to do to add to your toolbox to make sure you're doing things that other folks may not be doing in our industry? It's going to be very, very informative. And I think I might have covered all of our things for the Monday news. So hopefully you're having a wonderful last part of the year. I cannot believe it's almost over. HAFA is here 24/7. If you can't reach me via the phone, know that I'm a staff of one for now, and just reach out to me via email or text. Anything that you need, I'm here. If I do not answer you immediately, please ask me again. It just means that I missed you. Doesn't mean that I'm ignoring you. I try to be the CEO that is there for you, that you don't have to talk to other staffers. You go directly to the source. I'm excited about our article in the USA Today. So many people have read it and commented about it. I will be traveling to Texas in the next September to visit with Tracy McMillan, one of our brand new members who's having a grand opening at her agency. She has agents all over the United States. She's going to allow me to have a booth and meet some of the agents that she works with, so I'm very excited about that. If you have a need or you would like me to come and visit with your city, state, I'm happy to do that. That's what I'm here for. We can provide CE. We can do whatever you'd like us to do, update of what's going on in Washington. Keep the Lower Healthcare Cost Act in your brain. Continue to talk to your senators. Continue to talk about Section 208. Keep doing what you're doing. I love working for you. And have a wonderful day. Until next Monday, Ronell Nolan, President, CEO, Health Agents for America.